Hello everyone. Today we will talk about sinus tachycardia. So what is sinus tachycardia? In sinus tachycardia, our heart rate is more than 100. Usually it is in between 100 to 150 beats per minute. Of course, we have to consider other factors as well. The rhythm should be regular. PR interval should be in a normal range, which is 0.12 to 0.20 seconds. It should be constant, and QRS complex it should be narrow, and duration should be in between 0.06 to 0.12 seconds. So if we see here, there is a P wave before every QRS complex, and we can see that this rhythm is regular. We have constant PR interval in our rhythm. It is not changed anywhere. And if we see our heart rate, it is in between, no, I will not say, it is around 140. We counted. So 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14. So multiply by 10, we have heart rate 140. So we will consider it sinus tachycardia. Next, we will talk about now we will talk about clinical significance. Sinus tachycardia is a normal response of a heart for increased blood flow. For example, in exercise, our heart pump really fast to supply blood flow and oxygen to our body. So in exercise, we will see our heart rate to be increased. Same goes for temperature. And if we talk about anemia, in anemia, our hemoglobin level is low. So what is the purpose of hemoglobin? It is to supply oxygen to our every cell of our body. So in this case, our oxygen supply is compromised. So our heart rate will be increased as a compensatory mechanism to supply blood flow and oxygen to our tissues or cells of our body. So we will see tachycardia in anemic patients. Same goes for hypovolemia. For example, if a patient has a GI bleed, that person can go to hypovolemia, and in response to that our heart rate will be increased to supply blood flow to our most essential organs of our body, which is brain and heart. And if we talk about hypoxia, hypoxia is a state in which oxygen not available in sufficient amount at the tissue level to maintain adequate homeostasis. So in this case, we will see our heart rate will be increased as a compensatory mechanism. And in chronic heart failure too, our blood supply is compromised, hypertension, and in response to sympathetic nervous system drugs as true, which is epinephrine and norepinephrine. The purpose of these drugs is to increase heart rate. So we can see sinus tachycardia if person is taking epinephrine or norepinephrine. Next, increased heart rate will increase myocardial oxygen demands too. So we have to make sure that oxygen saturation is normal in these patients. Next, what is the treatment of sinus tachycardia? It all depends what is the underlying cause of sinus tachycardia. So if pain is the reason for sinus tachycardia, we will treat it with the effective pain management. For example, in acute MI, or any other disease condition, we can give morphine or any other analgesic to treat the cause of sinus tachycardia. For clinical stable patients, we can perform a vagal maneuver. Also, we can give beta-adrenergic blockers, example metoprolol, to decrease heart rate. Adenosine and calcium channel blockers. These drugs dilate our blood vessels, which in result increase blood supply to our heart and decreased heart rate. In clinically unstable patients, we performed synchronized cardioversion. So this is the treatment of sinus tachycardia. That's all about sinus tachycardia. Thank you for watching my video, and if you like it, you can learn about other rhythms. You can go to my channel and see about normal sinus rhythm and sinus bradycardia. Thank you for your time.